Welcome to log rolling a client. Now you may think log rolling, that's quite an odd thing to do to a client, but this is actually a really useful tactic that we're gonna do to help change a bed, for example, or to help move a patient up in bed. So let's take a look at this. Now, why do we even log roll? This method is really important if someone has a spinal injury, for example, or we need to keep that spine in alignment when we move our patient in bed. Now, this is also really useful for a bedbound client. You can imagine being in bed's really uncomfortable. Sometimes the patient gets pretty stiff. So this is a nice fluid way to move the patient as well in bed. Now, we can also use this for repositioning, like I had mentioned earlier, to change bed linens when a patient's in there or providing a bed bath. Now, when you log roll, it's ideal that you want at least 2 of you. Sometimes you may use 3. So use your discretion on this. So first of all, what are we going to need to log roll our patient? Now, if your facility has a slide sheet, that's really great. All these are really slick and it kind of helps move the patient around. But most commonly, you're going to see a draw sheet. It's going to look a lot like just a plain old sheet, and we can use this as well. And again, don't forget, it's much safer to use another staff member when you log roll a patient. So try to get help. So before we start, don't forget your hand hygiene and make sure you provide privacy for your patient. And as always, we want to make sure we tell the patient what's going to happen next and explain the procedure. Now, anytime you log roll, it's important that you position the bed to a comfortable working height. Now remember, you may have a partner helping you here, so it needs to be comfortable for not only you, but also your partner. So make sure you get agreeable position. Now that we've positioned the bed, now we want to lower those side rails, however, only if staff are present on both sides of the bed. This is really important. Anytime you lower a side rail, make sure staff is standing on each side of the bed. We don't want the patient rolling out here. Now, this is a good time to stand directly next to the bed. Now, before we start, position your patient where you can reach the client's shoulder and their hips. This is really their trunk area and the heaviest part, and this is where we want to center ourselves. Now we want to have our client fold their arms across their chest. Think of like a mummy. So this is going to be helpful so when they roll, it's much more comfortable and their arms don't get tangled up during the log roll. Now we want to grasp the far side of the client's body. So you're going to be rolling the patient towards you. So you want a hand on the shoulder and even the thigh or the hip, and you're going to place those both at the same time across the patient. Now we want to turn the client towards us, again with your hand on the shoulder, on their hips or thigh with one motion. Now, here's the key note here is that you want to communicate as healthcare providers. So it should be one swift motion with you pulling towards you. Your nurse on the other side is assisting the client towards you as well. Now, it's always useful to use a draw sheet here. So instead of grabbing onto the client, their shoulder and thigh or shoulder and hip and moving, sometimes it's much easier to either use a draw sheet or a slide sheet, for example. You can grasp on the sheet and use that to assist you. Now, once we've log rolled the client, it's a great idea to place pillows behind their trunk. This is definitely going to ensure alignment and support, and it's just much more comfortable for the patient. Now, before we leave the room, again, make sure that client's in a comfortable position. And again, don't forget those side rails. Make sure those are up. Put the bed in the lowest position before you exit the room. Perform that hand hygiene, and maybe make sure you document. Hi guys, I'm going to show you how to log roll a patient. So I've got some assistants here, Dean, and you may think, well, okay, what is log rolling? This is actually used quite a bit in nursing, especially with someone who has a spinal injury, for example. And what I'm talking about is when we log roll a patient, the main objective is to move the patient in one swift, smooth movement, and it also helps keep their spine in alignment. Also, if someone's bedbound, for example, and we need to make their bed or turn them over, this is a great technique that's really comfortable and much easier to manipulate and move your client. Okay, so now let's go ahead and get started. Of course, when we enter a room, make sure we perform our hand hygiene. So when log rolling a patient and you have assistance, which I definitely recommend, log rolling is usually a 2-person piece to that, so make sure you get help. So once we've performed our hand hygiene, again, you can see some height differential between me and Dean. You want to make sure there's a good working height for both parties. Then you want to make sure you communicate on which side the patient's going to roll. So that's something you want to work out with your team member before you get started. Okay, so now that we've got the bed to a comfortable working height, now since me and Dean are on both sides of the patient, we can remove the side rails. And don't forget, as a nursing student or a nurse, never put down a side rail if someone's not there. But we're both here, so let's do that now. Okay. So we've removed our side rails. So now what we're going to do is take the patient and we're going to log roll them towards me. So anytime you log roll a patient, again, you want to communicate, explain to the patient what's going on. If they can help you, that's great. Sometimes though, the patient cannot, especially if it's a patient with a spinal injury, for example. So before you log roll, one thing to keep in mind, anytime you log roll the patient, you want to use the heaviest portion, which is their trunk, to help move them. So for example, what I mean by that, when I log roll, I'm going to place my hand over the shoulder and the hip of the patient when I help turn them. So this is really the main portion of the patient's body, and we're going to do it all at once. So I can use that with the help of Dean. Also, if you have a draw sheet or a sheet underneath the patient, Dean and myself can use that to also lift the patient if you need that with your patient. Next, after you log roll, you can help stuff a pillow for support. So now we're going to demonstrate. So make sure your linen is loose because you're going to be moving your patient, right? So now what I'm going to do is, with the help of Dean, I'm going to take the shoulder. Then notice I'm going to take my other hand behind the trunk. And again, notice me as someone who's not very tall. Now as a person, we don't want to stoop over, but make sure that maybe you squat a little bit and making sure you're keeping good body mechanics. So now I'm going to reach over. I've got my my hand behind the shoulder and behind the hip. And with one movement, we're going to log roll the patient. So notice here that the patient's spine stayed in alignment, and now Dean can put a pillow underneath the patient for support of that back. Great, thank you, Dean. So a lot of the times you may also turn a patient this way as well if you're trying to offload them from their back, or change linens, or just reposition the patient altogether. So make sure that the patient's comfortable and their body's aligned. And then of course, before you leave, make sure the side rails are up, that the bed is in the lowest position, and you perform hand hygiene before exiting the room.